Tennessee's rural hospitals are in crisis. More than a dozen closed in the last few years. And tonight, frustration and anger from a man who's trying to reopen a shuttered emergency room. Chris Conti continues his ongoing series, Emergency at the ER.
It sits here in silence, in emptiness, perhaps in perpetuity. The death of Cumberland River Hospital lingers on.
It's sad that people can't live in their hometown and have health care.
When Johnny Priestley bought this place back in July, he knew he had his work cut out for him.
You're a Medicare administrative contractor.
But he did not realize just how difficult reviving a closed hospital would be.
You sit on hold sometimes for an hour. It's ridiculous.
Every day, he is on the phone with Medicare.
Okay.
For weeks now, he's been waiting for the government agency to provide him with a certification number.
We have your application.
It's incompetency in our federal government.
He cannot legally open this hospital until he has that number. He also needs that number to submit insurance claims for patients. And in a poor rural community, that's critical.
85% of the population here in Clay County have Medicare.
It was March 1st when Cumberland River closed, becoming the 11th hospital in the state of Tennessee to shut down. The closest emergency room is now a 45-minute ride away, and that's on a good day.
Lives matter. You know, just because you live in a rural area shouldn't mean that you're discriminated against and not have access to good health care.
There's an economic factor to all this as well. When it's open and running, Cumberland River generates about $20 million a year in revenue. And there were 142 people working here. Johnny Priestley would hire them all back tomorrow if he had approval to open.
It's a little dark, but it's ready.
Walking the empty halls here, Johnny sees possibility. He has doctors ready to perform scheduled surgeries. All the supplies they would need are purchased. The helipad is back open, and the signs are here. Yet there sits Clay County's lifeline, empty, dark, and desolate.
Hospital's still not open. What's happening out there? People are dying.
Having spent hundreds of thousands of his own dollars, Johnny is now out of money.
But
for the sake of this rural county, he is clinging onto hope.
If we don't open this hospital back up,
would you like a call reference, sir?
this town will die.
Chris Conti, News Channel 5.
Johnny Priestley has reached out to Tennessee U.S. senators and a handful of House representatives. So far, though, no one has been able to expedite the process of getting Medicare certification.